And now the end is near, and so
and remove it for examination. Finally, your surgeon will insert drains to prevent fluid collection before closing the wound. The most common type of mastectomy is a modified radical mastectomy, in which the entire breast and some or all of the lymph nodes under your arm are removed. In this procedure, your surgeon will make an incision along the length of your breast, separate your breast tissue from the muscle underneath, and remove it for examination.
Outpatient and inpatient trials under the direction of Associate Professor John Amarina. Making up the research unit are a dedicated team of healthcare professionals, including a number of highly experienced clinical trial registered nurses, a medical research fellow, and an administrative clinical trial assistant. The team is also supported by a number of experienced cardiologists who perform the role of sub-investigators. The unit participates in many large-scale international research trials in cardiovascular
different disciplines who are asking all kinds of interesting and different questions, and all doing it because they care about kids and want to make their lives better.
There is a reward every day, kind of when you leave every room, and there's definitely the challenges, but the rewards greatly outweigh them.
I'm humbled by how impressive this institution is and the work that it does to influence patient care and child health more broadly.
Further into the papillary layer and the reticular layer. The papillary layer is important in forming our own unique fingerprints. We have the third layer below the dermis called the hypodermis, hypo as in below, that is actually not part of the skin. The hypodermis contains many adipose tissue. Adipose tissue are just
In this video, I will teach you 10 words that you may be pronouncing incorrectly even if you're an advanced speaker of English. These words are commonly mispronounced by some native speakers. That's why I always tell you, be careful who you imitate. If you want to sound educated and professional when you speak English, I will teach you how to correctly pronounce these 10 words.
On this side, and what this does for me is it gives me two ways to assess respirations. First, while I'm looking at my second hand, I can see peripherally across the top and see the rise and fall of the chest with peripheral vision, but I also get the tactile sensation as she takes a breath. There's a slight movement of my arm with each breath. So calculating the rate per 30 seconds and multiplying by 2 gives me a total rate per minute. If the respiratory rate is too slow or too fast, you can actually count for the full minute, and it gives you a more accurate rate by not having to multiply. When you are
far away, it will blink red. So it will beep and it will blink red. When you bring it back, it will start blinking blue again.
I have to travel soon. Can I bring it on an airplane?
We can give you a note that says that you have a medical device in case the TSA people have questions about this, but I don't think that they will even find it.
What do I do with it when I sleep? Do I have to have that on my body?
So it needs to be close enough to sense the probe and get its data wirelessly. We definitely want to be collecting data while you're asleep because a lot of people have acid reflux while they're asleep. So,
which is basically where a woman's ovaries get stimulated with hormone injections to produce lots of mature eggs at once, which are then collected by a simple procedure and fertilized with sperm in a little dish. Her embryos were allowed to grow for 5 days before one was inserted back into the womb. Normally, leftover embryos that develop properly can be frozen and used for more IVF cycles later, without needing to stimulate the ovaries each time. Becky's IVF didn't work though, because how well it works.
You know, have slightly teary moments, especially in the office, with the doctor, or with any of the nurses. There's real compassion there, and they must see a lot of people coming in and getting quite teary, but there's never a sense that they don't have time for you, and they don't have time to talk you through it.
Yeah, they never rushed us.
Yeah, exactly. So there's, I mean, not feeling like they're sort of, you're one of 100 people today who's coming crying. They were amazing and very supportive.
And created a real sense of hope.
Yeah.